Welcome back. This is a hearing regarding Encompass Health Rehabilitation Hospital at Branford, docket number 25-32826-CON for the establishment of a new healthcare facility in Branford, Connecticut. Are done with the technical portion and the public comment portion. So now we're going to go over late files and then we'll have arguments. I am going to start first with the late file that we would request of the applicant. Or the applicant has offered to provide. The first one is a response to these two documents that I have here that Hospital for Special Care introduced today at today's hearing, which just so that everybody is clear, I'm going to do the transcript as Exhibit DDD and the earnings call presentation as Exhibit EEE. So it would be a response to that. If you want, you don't have to do one in writing, but you're free to. Ms. Chafin will add LTAC to slide 6 of her presentation, recalculate that and provide that. Number 3, we wanted to know admission data for Danbury, Encompass Danbury, the amount of patients who are from New York versus Connecticut. Ms. Chafin, this is number 4. She said she would find whether she had any additional work papers regarding how the PSA was derived. To the extent that there have been other reports that have been aired, would ask for that. Or even if it's not a report, just any sort of analysis. And number 5, one of the questions we had was whether the national reported differences noted regarding potentially avoidable hospitalizations for IRF, SNF, and LTAC are representative of the Connecticut experience. The applicant indicated they hadn't looked at readmission rates specific to Connecticut, so it would be looking for a late file in that regard to the extent that that could be. Rocha, is that consistent with what you have in your own records, and is there anything you want to discuss?
I have a few others, if I may. We would ask that Gaylord.
We'll get to them in a
Okay.
In terms of what I'm asking of client, is that accurate based on your records?
We would also ask if we could have a citation to U.S. News ranking article about opportunity.
So when I issue my order tomorrow, and the order will be more specific than what we're currently discussing, but when I issue that, I will provide citation.
Great. I just have one. That's all we have. Like the applicant.
Okay.
A couple others.
So going to turn to Hospital for Special Care first. Because that's the order in which I wrote things down. But you requested an opportunity to respond to Ms. Chafin's updated tables and graphs. That'll be number 1 And actually Gaylord requested the same opportunity, so that'll be one for you as well. Back to special care. You said you could dig up and provide data regarding when and for how long you stopped admissions. And I believe those are the only two for special care. Rocha, do you have any others for them? And then I'll turn to Gaylord.
For special care, no.
And Cowherd, do you have any others that you were supposed to provide?
Trying to tell us to go home. Telling us we're done.
Gaylord, number two, the applicant requested proprietary data that Gaylord had paid for. And Letty, you said you thought you had submitted this. Yeah.
I'm not sure, we may have redacted something. It's okay, we can. I send you an email tomorrow after I've looked at your files to see what was said. This came up the last time, I just don't know how we solved it.
I was going to say, I think you need to have a conversation about whether that needs to be submitted confidentially.
That may have been what we. Don't know.
So if we need to have a conversation about that, then schedule a time for the three of us to get on a call and what the best approach to that would be.
Visible.
That would probably be
We have a license, we don't know sure, right? License for a state agent. So I'd have to look at the terms of our license.
I hear that. I like an opportunity.
Yeah, so that's what the hearing officer was saying. We will get together, have a meeting for about what the license restrictions are, and then whether it can be used, relied on, or in any way, or whether it's just, essentially disregarded. How we're gonna.
So you can just provide us with an update on that. That was GI care compare, was that yes or DGI care compare document?
They were offering that instead of fit.
That's an additional one for you guys. I'm sorry. I just put that in the wrong place. So you're offering that in place of the then that'll actually be number 6 or yeah.
7.
It's the US News ranking.
Oh, well, yeah, well, OHS is providing that. Oh, yeah. Well,
Hearing officer. Secretary of things that plus 5. Except the states, including Hawaii.
You can't hear me, you got real loud.
Sorry. It includes,
can you just back up?
it looks at, readmission rates from SNFs in states where the applicant has identified as a not of large penetration of nurse. And you provide data on how skilled nursing facilities that in Connecticut are relying on a substantial part of their rehab patients to be treated in a skilled nursing facility, and how they line up in terms of their readmission rates once a person is discharged from the skilled nursing facility, how that looks compared to national data. And again, we think because readmission rates in those states very low comparatively to U.S. averages, that would be helpful for the agency to understand, to follow the predicate of my request.
But I don't know why that wasn't brought up.
I just asked for a late file. I can, it's,
Could have been submitted as pre-file submission.
I'll sign up earlier and start making.
please.
Late file is not just volunteer new evidence. Late file is us following up on things brought up at the hearing that were not answered.
Publicly available data, but if that's how the agency wants to view it, that's fine. The reason I raised it is because applicant has said that these have low discharge rates. Where if you know, in the interest of justice, certainly the applicant would have the ability to rewrite just as we are. That ability. Low IRF penetration in a given state into or discharges from nursing facilities, rehabilitation that result in that same patient having to be readmitted to a hospital. That's the purpose. I invite the applicant to on that, but I think under the evidentiary standard, and I do apologize if should have been brought up earlier. Didn't see notations on that. I have other data that isn't that's kid to that, but I might get to rebut it anyway. Please fit.
I'm not inclined to allow that in. As it really should have been on that way. And had to reschedule the hearing, and I don't want to have you submit that and then have to give them additional time to respond and then inappropriately back and forth.
This is in direct response to a question for them that they were not being. That's why I'm bringing it up.
If it'd be helpful to continue this dialogue, what is cited, but not miscited at page 10 of Ms. Rudman's testimony is that again has found that
It's cited in the record. We'll consider what's cited in the record. And you'll have your opportunity for closing momentarily.
understood.
Thank you.
Understood.
All right, let's finish the late files.
I think that the Gaylord 3,
That's right.
there is just one. So there's two individuals that you identified as going from Gaylord to one of two individuals.
We'll find it.
We'll do a message finding.
We don't want specific information. We just want to know whether those people live closer to Gaylord or closer to Danbury. It's like a yes or no.
But I thought sorry, just a clarifying question. I thought we were looking at anybody. So that or maybe from. Interested. I thought we were looking just for professional.
Where they live. Okay, so the profession and where they live.
Less concerned about the profession or where they live.
Travel distance, travel distance.
Yeah. Did they leave because it was closer to?
Understood.
You'll never know, but
Do it. Officer, I apologize. I'm having a. Just want to make sure I understand. I believe. I missed the It's all B, all right. Testified, he believed one or two, he's left to go to Danbury. Good. From that, and then if you can find out where they live.
whether they lived closer to Danbury than they do.
And I guess one, if you also provide, because I think it's how many employees, the average. That's. Turnover and retention.
That's you.
We have 15 more minutes. I have to go speak with security.
I
So we're gonna go off the record for our mistakes. And then we'll